Hello, my name is Cameron, and for my project, I decided to do substance abuse, but I really wanted to focus on heroin. And throughout my slides, I talked about the impact that it has on people, who it affects, the background and the history of it itself. And then by the end, I talk about different treatments and recovery that people go through to get over the addiction of heroin. Throughout this slides, I might stutter, so please don't mind it. I don't know what I'm doing, but we're going to get through it. So for the first slide, I decided to talk about addressing the topic of substance abuse as a whole, because not only does it affect the person doing the drugs, but it also affects the people around them. It can break up homes, ruin good relationships, and overall mess with someone's well-being and overall health. Drug addiction, regardless of what drug it is, it can go to a state of no return, and it can go from health issues, long-term, getting involved into the legal system, or overall overdose or death. But addressing this issue and allowing people to have prevention can allow people to feel more comfortable to open up to addiction and actually seek help. What is heroin? As we know, heroin is an addictive pain relieving drug. As you can see, it comes in pills, powders, but it can also come in different colors such as dark brown or black, because the black is like a black tar that's sticky when it's first formed from the plant. Like I said, it comes from a plant. This substance comes from the opium poppy plant, but heroin is made from the opioid drug morphine. It's like another version of morphine. The chemical process for this, it comes from the seed pod of the plant itself, and from that, it comes from like a sap I seen in pictures, and it can be chemically modified, and while sitting, it can form into the black tar, and as it sits, you can grade it down into the white or brown powder. This video shows like the beginnings of the history, so I'm just going to play a little bit to show the different years that it got brought up before it hit the United States.
Whether it's heroin, morphine, or today's synthetic opioids, it all traces back to the same origin, the opium poppy. Some of the earliest references to the plant date back to 3400 BC. It was used by the ancient Greeks, Persians, and the Egyptians. A milky sap from the flower processed to produce opium, which people would smoke to help them sleep or relieve pain. By the 7th century AD, opium made its way to China and East Asia. Fast forward to the 1700s, the British Empire begins smuggling opium into China through the East India Company. As a result, opium addiction in China. China's attempts to outlaw it in the 1800s even sparked 2 wars with the British. Opium use spread to the U.S. during the California Gold Rush, when thousands of Chinese workers came to the country.
So then, once heroin was reached in the United States, it was classified as an illegal addictive drug because it was brought and incorporated into the United States through doctor prescriptions, because they were using it to try to treat pain from the wars and things of that sort. But once people started to notice it was inexpensive and it needed to be prescribed, people started turning to street heroin, which also has the negative side effects of it being tainted with and having certain things like fentanyl or things that can ruin your body's well-being and overall lead to overdose. Like I said, addiction as a whole is reversible. You can get treatment for it, but it is a very dangerous game and basically a disease for someone in their brain. The way people can become addicted to anything, but especially heroin, can be peer pressure, the stress or trauma of something that you're going through, the exposure at a young age, such as generations being passed down or, in a household. While addiction is a never-ending cycle, heroin specifically invades the brain, which can cause euphoria. I don't know where the A is at, but these effects can mess with people's self-control and decision-making. But overall, repeating these behaviors or even seeking for higher doses of a higher drug is addiction. For this page, I decided to put statistics about the previous years about heroin being misused. So in the year of 2022, 3.2%, or basically 8.9 million people misused heroin. And it started from the ages of 12 and up, which was very shocking to me because there was a high level of 12-year-olds and teenagers basically using heroin. And as you can see, from 2022 to 2023, there was a huge jump into the double digits of 16.7% of people misusing heroin, which I also thought was crazy for how big of the year gap it jumped, but it was just overall crazy. Who does this addiction affect? It affects anyone of any age, of any race, because it's so worldwide, because it was distributed throughout, like, different continents. But anyone can be affected by it. Heroin does not pick and choose. It has whoever wants it gets it. For the regions of heroin, like I said, and in the video it showed that it started from China, or traveled to China and went from Africa and all types of things and moved to United States. So urban and rural areas are affected by heroin. Is not, like I said, a pick and choose situation. Here are the statistics of deaths based on heroin, or like from heroin. As you can see, it's the dark, like a darkish blue line, and it starts to rise about 2011, 2010, and it keeps increasing about to 2018, and then it starts to decline. But as you can see, that's a huge jump from 2010 to 2018, how high it has risen. The consequences in society from doing heroin, having addiction to heroin. If you didn't know, heroin can be injected or smoked. So with the injection portion, that when you share needles with other people, you can contract HIV and other infections because of its straight, like, to your bloodstream and things like that. It can also cause organ damage caused by smoking or injecting heroin. But not only does it affect the physical harm of someone, but like their outside resources like jobs, money, legal system, and family can be broken and messed with because of this addiction. The stigma around drugs as a whole is already negative, but the attitudes of society matter towards someone trying to feel like they have a chance to recover, because when the society feels like it's self-induced, like it says in this quote, no one feels the need to try to offer help, so no one seems the need to, like, seek it, if you know what I'm saying. So the stigma and the attitude does matter, but the stigma around heroin itself, if it's self-induced, a lot of people don't really care for it. If you are trying to stop taking heroin or trying to get off the addiction, like trying to go cold turkey, whatever the case may be, withdrawals are real. They go from runny noses, anxiety, elevated blood pressure, joints and pain. Overall things you feel when you are sick or just at your lowest happens when you're withdrawing from heroin. This is one of the top, like, treatment ways to deal with heroin. Naloxone is like a medicine that reverses opioid overdose, and it can come as a nasal spray or an injection, as you can see. This video shows the side effects of using this treatment. While it does have like a high ranking of helping people, it doesn't help addiction as a whole, but it does help with, like, the cravings for heroin.
Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as naloxone.
We're going to skip him a little bit.
Using the Narcan intranasal spray. Initially, we would give one spray, which would be 2 or 4 milligrams, intranasally in one nostril. The use of a new Narcan nasal spray for subsequent doses is necessary, and we would administer into alternating nostrils. The dose may be repeated every 2 to 3 minutes. For the reversal of
Also in this video, it talks about the side effects.
We'll go over some of those here now. Some patients may experience redness at the injection site, dizziness, or a headache. Some more rare but serious side effects would be hypertension, high blood pressure, or hypotension, low blood pressure, pulmonary edema, or a seizure.
This is just a picture I put to overall say, like, side effects from treatment do happen. Like, it doesn't just be a clean slate, but treatment is a step to recovery. Like I said, different treatments they use is behavioral or medications. Like I said, the medication portion is mostly just a detox thing. It's not to get over addiction as a whole or heroin, but it's supposed to, like, ease you off of it or your cravings for it. But they do have different therapies or managements, like cognitive behavioral therapy, to help you, like, with your decision making and try to rebuild your senses to make good decisions. I'm so sorry. With treatment, 40% to 60% of people relapse at least once within the first year of treatment. But in their lifetime, 80% of people experience maybe a relapse. So no one's going to have just cold turkey and continue. They do, people make mistakes and things of that nature. this video is basically her personal story of how she overcame or trying to get over heroin and her relapse.
Over again. All different ways, but it all ended up with the same result, me using again. From, meeting up with old friends that I used to know that, they were using, I was using with them before, but, I'm better now. I'm going to these meetings, I'm, doing what I have to do, so I can hang out with them. And I remember I did this, and the first day I hung out with someone from, my old lifestyle, I used that exact day. It was just, it picked up right where it left off, and it was just starting everything all over again. It was just a big slap in the face to myself.
Like she stated, being around certain environments or people that do use or you used to have that kind of lifestyle with, they do affect how you relapse. They do have a big part in how people do relapse. But the road to recovery, step 1, just get the detox. Get supervised when doing the withdrawal so it can be safe, because there do be bad withdrawals from addiction, especially heroin, since it's so potent. Medications, like I said, like the nasal spray or the injection version of it. Support. Good support group. You need friends, you need family that will help you and support you. But also get professional help. Get therapy. Go to the groups. Go to the meetings. And get that help. Like, people are willing to help if you ask for it. And maintenance, which is the last step. You need to maintain this lifestyle. You can't just do it for 1 year and mess up and just keep going back and forth with the same cycle. Like, you need to make sure you change your lifestyle to be on the road to recovery and it be full and over with. These are just my resources slides. I'm so sorry. These are my resources for everything that you've seen. And yeah, thank you. Like I said, please don't mind me. I don't know what I be doing, but thank you, and this is my presentation.